SOWs up here, and we're in the 12th. But the 13th is going to start this summer, so these goals will change a little bit. But we have resources, subject matter experts around opioids, patient safety, chronic disease self-management is going to come into play today with a discussion that we're having. Care coordination, everything COVID-19, immunization. So we're looking at, for CMS, flu, pneumonia, and the COVID vaccines. And then this training piece over here was just for long-term care facilities. And we verified that the training that the frontline staff are getting on infection control is one that is a best practice type of training. So Project First Line, there's other things out there too as well. So that's what that was about. But today, for our presentation today, we're going to talk about quality assurance and performance improvement, and how do you even identify where to start working. That's called a problem statement. This slide here, though, it's talking about long-term care. When I'm discussing QAPI, it comes from that long-term care program, which was sent out years ago for nursing homes to start utilizing. And it takes a approach where they're looking at quality assurance and performance improvement. So we went from, in long-term care, a reactive approach to quality improvement to a proactive approach. And that's what these are saying. So quality assurance, in that, you're just really measuring yourself against standards of care. It's required and reactive, like I said. You're looking at your bad apples or the things that went wrong, and few people take responsibility or move forward with that. With performance improvement, it's a continuous phase of improving whatever is going on in your organization. You're proactive, so you're looking at opportunities for improvement, we're going to call it that, and processes and systems, and then everybody is part of performance improvement. Okay, so for today, again, we're just going down to a very basic, where do we start? And that's going to be a problem statement. So when we're doing PIPs, or a process improvement or a performance improvement project, you're going to have 3 questions for that improvement. And today we're looking at, what do we want to accomplish, or that problem statement. And in the presentation, I actually have samples that we worked on with the 3 areas that you guys are interested in. So we're going to have those. And then in May and June, we're going to move forward off of the problem statement. We're going to move into how do we measure it? How do we know that the change is an improvement? So that's measurement. And we're going to do root cause analysis and a plan, do, study, act. And I have forms for that will be filled in for samples for you guys to utilize as you're going forward. Okay, so today, again, problem statement, just think that's all we're talking about today. A problem statement will review your current process. So again, talking to Ginger and Maddie, we looked at these areas that are bulleted. So patient no-show rates, health outcomes of patients with hypertension, resource utilization rates, and patient satisfaction reports. So these are some of the things that you could gather and look at if you're working on these types of areas, and you're going to identify those opportunities for improvement. So that's how we label where you need to make an improvement, is you have an opportunity for that. So we're going to look for where there might be a breakdown in that system or that process. You can identify if there's workarounds, because your staff are going to figure out a workaround. If there's a barrier to complete a task, they're going to figure out how to work around that. And so if you meet with them, talk to them, and gather their input, sometimes you can identify where those are happening, and then figure out, is this a barrier we can overcome by doing some sort of a process improvement? Variations might occur, and duplicate or unnecessary steps, so eliminating those. All right, this is a blank form, and then we're going to get into the ones that I filled out. But this is a goal setting or problem statement form from Alliant Health Solutions. So you guys are welcome to use this in your organization. The link is right here. But we're going to walk through opportunity for improvement. So what is the problem that we want to address? And then we're going to fill in these areas here and kind of talk about that. It's probably pretty small. So let me read that for you. So this one's going to be resource utilization. So describe the business problem to be resolved or solved. So during review of student interns and retired physician schedules, it was identified that patients not showing for appointments is negatively impacting the optimal utilization of these practitioners' time. That's as simple as a problem statement can be. So you're just looking at they're not showing up. We have these great opportunities with interns and retired physicians, and we're just not utilizing their time because the patients aren't showing up. What do we want to accomplish? So we're going to move down into that area that we want to get the student intern and retired physician scheduling to fulfill time offered with attended appointments. So we want to fill their schedule and make sure that those people show up for their appointments. Who will be involved? We're just throwing ideas out here. This might be different in your organization, but we could have business office, patient navigators. Definitely include the patients in this work if you're looking at that, like getting their input. Interns and retired physicians, because they're involved in that scheduling. So those are the individuals that would be involved in discussions, brainstorming, identifying barriers, that kind of thing. Where will it take place? It's going to be in your organization. And then we're going to talk about how you're going to measure that, right? So we need a numerator and we need a denominator, because when you're doing a PIP, process improvement, you want some sort of data so you can show we started at baseline, now we're at this point, and our goal was this other number, and where are we in the process? So that way, as you're working through your PDSA, you can come back to this and notice that you've made improvements and maybe even identify another barrier that comes along as you're walking through it. So the numerator for this is going to be the number of missed appointments. The denominator would be all of the people that were scheduled for appointments with those individuals. And then we're going to say here that our baseline was 33%, meaning 33 patients out of 100, excuse me, missed their schedule in whatever time frame you're looking at. So it might be a 3-month time frame, it might be a 1 month, you might even drill it back to a week, however you want to do that. But so baseline's 33%, and we want to get to 10% or less. Understanding some people might miss an appointment, so 100% is going to be way out there, lofty goal. So maybe 10%, and then look at it again. Can we get that reduced a little bit further as we're working through this? We base this on an organization's benchmark. So your organization is saying, we want this to be 10% or less in our organization. Was the measure set too low? No, it's not set too low. And is it too high? Or is it high enough to have a stretch without being unreasonable? So yes, it is. So we know 10% is a stretch from 33%, but we feel like we might be able to get to that number. And then briefly describe how the goal will address the business problems stated. So this statement up here, by increasing patient attendance at scheduled appointments with interns and retired physicians, the organization will optimize the practitioner's time and improve patient outcomes, because if they come to your appointments, their outcomes are going to be better. And then we're going to have a target date for 6 months to get to that 10%. That's our goal. All right, and then at the bottom, I know this is tiny, I'll read it off. And again, these are Ginger and Maddie have these, but this would be your SMART goal. So we've got the problem statement. Now we need that SMART goal, with all of the pieces that are involved in that. And so we need it within 6 months, all patients scheduled for appointments with interns and retired physicians will receive appointment reminders and discussions of possible barriers of appointment attendance through phone calls by the business office. So we're going to make sure that they can come to the appointment, and then we're also going to identify if there's any barriers, transportation, co-pays, whatever might be out there. We're going to maybe discuss that on the phone. Business office will provide feedback to barriers to patient navigators in efforts to provide community resources to patients. This will decrease missed patient appointments to 10% or less and improve patient health outcomes. So on that, I want to stop and take a breath and see, does anybody have any questions? And you can put them in chat or come off mute about this topic before we move to another one. I get thumbs up if it's making sense to you. There's a react button up at the top. If you can give me a thumbs up, making sense. There we go. Okay. Very good. Thank you. Thank you. Okay. We'll keep going. So the next one that we're looking at is just missed appointments. So not so much the utilization of the time of those practitioners, but missed appointments at your organization. And what can we do? How do we word that? How do we track it? What measures do we have? And what is our SMART goal going to look like for that? So for this one, during review of appointments, the team identified opportunities for improvement in decreasing missed appointments by patients. That's as simple as a problem statement can be right there. It's usually one or two sentences, really getting to the point. And then we get into the specifics. So what do we want to accomplish? We want to improve patient attendance to established appointments by reducing barriers of any of these items: transportation, copay, childcare, social determinants of health, and I don't know why reminder's in there. I need to take that out. So those areas, though, we want to talk to them and make sure that these are not an issue or a barrier for those people to get to their appointments. Who's going to be involved in this or affected by this is going to be front desk staff, CHW, a dental support staff member might be, and dental patients if we're looking at this as a dental office. And it's going to happen at the facility. Our numerator and denominator here, again, would be number of patients missing appointments quarterly. So we're going to look at this on a 3-month basis. Denominator, all patients with appointments quarterly. So if we look at Q1 2024, we go back and we gather that numerator denominator, it might look a little something like 34 for numerator, 100 for denominator. If you can't, math is not my big thing, so I like to use that round number. So here we're looking at 34% no-show rate, and we don't want that. We have opportunities to improve that. We want to get to a goal of 12% or less for a no-show rate. This is based on an organization benchmark again. So your organization, dental office, wants to have a practice of 12% or less for no-shows. Is it too low that you're not going to challenge yourself? No. Is it high enough that you're stretching? I believe so, going from 33 to 12%. Decreasing no-show rates will improve patient outcomes and services needed. So that's how it's going to affect the business problem over here. And we're going to do that within 6 months, again, giving you a couple of quarters to work through. So your SMART goal here, within 6 months, business office will complete 100% phone calls to patients with an appointment scheduled in the upcoming 5 days. Business office will verify appointment day and time is accepted by the patient and will also identify potential barriers to appointments attendance. All barriers identified will be shared with the patient navigator in efforts to provide community resources to overcome the barrier. This will decrease missed appointments by patients to 12% or less. So there's your goal. On this one, I don't know if I shared that. So there's a website called findhelp.org. You guys know about this? Shake the ones on camera. Okay. Findhelp.org. And if you're a multitasker, go to that site right now. You're not going to miss anything with me. So what you do, you go to findhelp.org. Let's say that you're in Carter County, because that's where I'm at over here. And I want to identify, I've got these patients that are having problems with transportation. There's transportation agencies in the findhelp.org. These are either going to be free or reduced resources for people. And you can go by your zip code and it's going to list all kinds of things. There's going to be food. It's around all the social determinants. So visit that if you want that. But that would be something for the person that I'm calling a patient navigator at your organization. So if they call and they talk to Ginger and they say, your appointment's coming up in the next 5 days, and Ginger says, I just don't have a way to get to that appointment, that's where your navigator could take that and maybe connect them to that resource. So that's a good little resource to have. Any questions on missed appointments and this goal setting sheet here? Thumbs up if you're doing okay still. I like those. Making sense? Good. All right, we'll go to our next one. And the last one here is our health outcomes. And I do have some resources from Alliant that I'm going to share with you after I finish this presentation. So goal setting health outcomes, how are we going to help this? Our problem statement for this organization is during review of health outcomes of patients with a hypertension diagnosis, the team identified opportunities for improvement with increasing patient knowledge and skills on chronic disease self-management. So what do we want to accomplish? We want to improve patient blood pressure, self-management skills, and practices to decrease emergency room utilization. So that's what we're hoping to accomplish with that problem statement. Who's going to be involved? We want the physicians here, nurses, the patients, definitely always include them, and then maybe if you have patient navigators. Where will it take place? In the organization during patient appointments and in nutritional mobile clinics, and maybe even at the farmers market events. So now we're trying to really get out there outside of our organization, and we're going to share all of this stuff as an organization at these events. So it looks a little different than the other two. What is the measure you will use? So we're going to use zone tools that include blood pressure and weight logs. That's going to be your numerators with patients uncontrolled hypertension, and denominator, all of the patients that you see for hypertension. So numerator, denominator, and we're going to include these zone tools, which I'll show you here in a little bit. So our baseline, no patients were using the zone tools at the time of building this. Baseline for rate of patients with uncontrolled hypertension is 51 patients out of 100. So we got a 51% rate. And then our ER rates for the patients with hypertension is going to be self-reported to you when they come into the visit. You may add a question during, if you have a hypertension resident or patient, have you been to the ER since your last visit? And that would be a self-reported data measure that you could gather. The goal for this one, so these are just ideas on how you can get data. The goals for this one is that 95% of the patients with hypertension diagnosis are going to be using the zone tools and the logs, and they're going to bring them to you. So that's one of our goals. Another goal might be that 95% of patients with hypertension will have controlled blood pressure and weights because they're using the zone tools and the education you give them. And then maybe 10% of patients with hypertension visit an ER between their visits to your organization. With this organizational benchmark, is it too low? No. Is it too high? No. It's got a stretch in there, so that's good. And then by improving hypertension patient self-care practices, patients will require less ER visits and will experience controlled blood pressure and weights. And we're going to do this in 6 months again. So here's the SMART goal on that one. Within 6 months, nurses will provide all patients with a hypertension diagnosis a person-centered approach to hypertension self-management training, utilizing the patient's preferred approach of adult learning styles of either visual, auditory, or kinesthetic. After training, patient will return demo of the knowledge and skills for the hypertension self-management use of the zone tool and the weight and BP logs that you're going to give them. This will improve patient blood pressure, self-management skills, and practices and decrease emergency room utilization to 10% or less. So thumbs up on that one. Are we okay? Are any questions on that one so far? Thank you. All right. Go to the next one. Okay, so I'm going to close out the PowerPoint, but then I'm going to take you to our website real quick. We got a few more minutes here, and then I'm going to show you those resources from us that I think might be helpful if you're working on one of these projects. But just so you're aware, this small problem statement presentation is going to be followed in May. We're going to do root cause analysis around those 3 topics that I just did. So we'll take the problem statement, and I'll have a root cause analysis sheet kind of filled in with ideas of where it could head, in your organization and what you might find out in a root cause. And then in June, we're going to look at PDSA, so the Plan, Do, Study, Act part of quality improvement. All right, let me Put that one down and we'll go here first. Okay, so these are the sheets that I just walked through. And again, Maddie and Ginger have these, but I wanted to show our zone tools because I talked about it on that one problem statement. So here's the high blood pressure zone tool. Do any of you use zone tools in your practice right now? You can use thumb up for that or thumb down or a no or a yes in chat. Zone tools for chronic disease. While you're doing that, I'll walk the zone tool. These are meant to go to with the patient, right? And this is where you would do the adult learning style to educate them on how to use a zone tool. Knows. Okay, thank you guys. So it will let them know, and some places laminate these and then have them put them on their refrigerator, that kind of thing. Other places will just print them and hand them to the patient while they're teaching. Thank you guys. So green zone, we're doing okay. We don't need to do anything. Yellow zone, this might look like this, and what do we need to do? And then the red zone, of course, down here, and get to 911. All right, and this is where we've got the blood pressure log. So these are your hypertension patients that we're wanting to reduce ER visits with. So, this person would fill in their blood pressure reading morning and evening, and then hopefully give it to you when they come back for their appointment. We have them for everything you can imagine out there. So here's a renal failure one. And at the bottom down here, we've got weight. So they're going to capture their weight and they're going to know if they're red, yellow, or green, and they're going to mark that for themselves. So it's getting a real good visual aid in front of them. Here's heart failure. We got weight on that one too. Okay. And come over here. Oops, come here. This is our website. So you guys are kind of new to learning who we are. Let me pop it in chat. Feel free to visit this. This is free resources to all of you. Everything out there publicly, anybody can utilize it. So I want to show a couple of things. We've got our events right here. So we have upcoming, we do everything virtual. So all of our events that are coming up and how to join those. And some of them actually even have CEs and things like that that are available. So you'll see that in red. So we've got April 24th overdose prevention training. And then we've got, what I wanted to show you at the bottom of the page. See this guy right here? You can order as many of those as you want. Yes, it does have our name on it, but it's free. It's plastic. It's a plastic bag and it says My Meds, and it's going to tell you to bring everything, prescriptions, lotions, eye drops, all of that stuff to your appointment. I use this because it's just easier to grab the bag, take it to the doctor's appointment. So you could utilize this. And I say everybody on this call, all you have to do is hit order now, and it'll take you over to this med bag order sheet. And you just fill in your name and all of this information. CCN number, well, thank you, Joel. I love them too. CCN number is not applicable. That's long-term care. So you would just go past that, but just fill in your information. And down here, order as many as you want, 100, 200, 25, whatever you want, right? Just get them to your building. And then what you can do with that is provide the bag and the zone tool to your patient with that education, and hopefully that loops everybody back together. And then this is just to show you, this is my wrap up. I'll make sure we got a couple minutes for questions, but the zone tools are on the web page. If you just go to the web page and put the word zone in, it'll pull you over to this. But we got COPD, kidney disease, depression, sepsis. There's pages of them in here, and some of them are in Spanish. If you don't find what you want, let me know, because we've got those kind of in different areas too. Yeah, trying to think of everybody. All right. That's it. I'm very quick. Any questions or comments? I see Mindy's hand up.
I really just had a comment. I just wanted to say thank you, because I think this was super helpful for the folks that were able to join. And just thank you for sharing your resources.
Sure. Yeah. So did Did you know what a problem statement was before you got here? Yes? No? And you know now? Kind of? All right. Very thankful. Very helpful. Thank you, guys. Good. All right. And the next one, root cause analysis. How many people love that? Like all day I do those. Those are fun. No, not so much. Okay. We'll do root cause at the next one. And I'm so glad I'm able to help you guys out and meet with you all. You do great work, and I definitely appreciate it here too.
Thank you so much, Julie.
Yeah.
We look forward to seeing you next month, right after the Safety Net provider meeting in May. Thank you so much.